Ladies and gentlemen, a very good morning to all of you. It is indeed a pleasure for me to address this very pertinent subject for this summit. Reshape tomorrow. Friends, it's been over a year since the outbreak of the pandemic, and while the world went through turmoil, faced various setbacks and losses, we evidently emerged stronger, wiser, more united, and resilient. I have often called 2020 the year of science. It's hard to put into words just how remarkable our accomplishments have been in the history of science. A vaccine development process that used to take many years, often decades, has been condensed to about 11 months. Just last January, researchers started out with a previously unknown virus, and we now have not just one, but several vaccines that will be administered to millions of people before year end. And the accomplishments don't end there. Several other types of COVID 19 vaccines are also on the way. And of course, India has been leading the way in reshaping the future. As we speak of shaping a new tomorrow, the ongoing COVID 19 vaccination drive happens to be an important milestone along the road. Right from the beginning, our government took proactive steps to enhance the preparedness of our health system to respond to all aspects of COVID 19. We followed the test, track, and treat strategy diligently and continued the emphasis on preventive measures to contain the spread of the virus, which includes wearing masks, washing hands, use of sanitizer, maintaining adequate physical distance, prompt testing on observing symptoms, and prompt isolation on testing positive. As a result, fatality rate because of COVID 19 in India has remained among the lowest in the world, while we have recorded one of the highest recovery rates globally. Following the onset of the pandemic, Government of India established a national expert group on vaccine administration for COVID 19 to guide all aspects of COVID 19 vaccination, including prioritization of population groups, procurement and inventory management, vaccine selection, vaccine delivery, tracking mechanism, and others. Keeping in mind the limited availability of vaccine doses initially, coupled with heightened global demand, NEGVAC prioritized certain population groups for vaccination. As you are all well aware, the prioritized groups initially included our healthcare workers, frontline workers, and people above the age group of 60 years. I am pleased to share with you that the COVID 19 vaccination drive in India has been progressing smoothly. On 16th January 2021, India started its national vaccination program against the SARS-CoV-2 virus. This day of the program witnessed vaccination of the highest number of beneficiaries covered anywhere in the world on the first day. Back then, our first and foremost priority was to use the COVID 19 vaccine as a shield to protect our healthcare workers and frontline workers. Within the first 34 days, we touched 1 crore vaccination, and in the subsequent weeks, we have opened the vaccination to other priority groups. To monitor any adverse events following immunization, it was imperative to have a strong data management system in place, for which we harnessed technology and created a unique digital platform called CoWIN to support the vaccination activity. The platform has been assisting program managers in registration and tracking of every beneficiary of COVID 19 vaccine, along with real time information on the available stocks of vaccine, their storage temperature, actual vaccination process, generation of digital certificates, and much more. Capacity building of the entire human resource was conducted in a cascaded manner, from training of trainers at the national level to the vaccination teams working at the ground level. Over 2 lakh vaccinators and 3.9 lakh other vaccination team members were trained in the process to be followed at the vaccination sites. The COVID 19 communication strategy for vaccination focused on building vaccine confidence through clear, consistent, and transparent messages and emphasized on providing correct information on COVID 19 vaccines, addressed vaccine hesitancy and vaccine eagerness while promoting COVID appropriate behavior at all the times. Throughout this vaccination drive, our focus has been on keeping the services as citizen friendly as possible. Since 1st March 2021, private health facilities have been permitted to function as COVID 19 vaccination centers while being allowed to charge a maximum amount of 250 rupees for the same. Online registration, booking of slots, and on the spot registrations are available for beneficiaries of the COVID 19 vaccination drive. All the COVID vaccination centers have been adequately equipped for storage of vaccine, provision of vaccination services, adherence to COVID appropriate behavior, and management of adverse events following immunization. A collaborative approach has been used for planning and execution of the vaccination drive. It sets an excellent example of how the federal system can work in synergy to maximize the reach of a program. The vaccination drive is being coordinated as a Jan Bhagidari Andolan, involving many stakeholders like ministries, departments, professional bodies, medical colleges, NGOs, CSOs, media houses, private sector, youth, and women volunteer groups. In Budget 21-22, my cabinet colleague Minister of Finance, Shrimati Nirmala Sitharaman, has made an allocation of rupees 35,000 crores for COVID 19 vaccination drive in the country. Presently, 2 Made in India vaccines are being used in the COVID 19 vaccination drive, namely Covishield and Covaxin. While both vaccines are being manufactured in India, Covaxin by Bharat Biotech has been developed in India under the ambit of Atmanirbhar Bharat. This has showcased our remarkable scientific acumen and vaccine development capability to the world. People have embraced our Made in India vaccines, and it is due to this enthusiasm and trust we crossed our last 1 crore vaccinations in just under 4 days. To ensure this trend continues, the government has also lifted the time restriction to increase vaccination speed. People can now get vaccinated 24/7 according to their convenience across India. Just a few days back, the government announced that from April 1, all citizens aged 45 years and above, whether having any comorbidity or not, will be eligible to get vaccinated across India. The government is already planning to widen the umbrella of COVID 19 vaccine beneficiaries in the near future to cover other sections of our population. Apart from striving to complete the mammoth task of vaccinating our population of over 1 billion people, we are also supporting other countries by supplying them with COVID 19 vaccines under our Vaccine Matri initiative. In these trying times, when clamors for vaccine nationalism are on the rise, our beloved Prime Minister Shri Narendra Modi ji, being a champion of global cooperation and humanity, has led the way by example. His decision to extend help to our global family not only resonates well with our age-old virtues of Vasudhaiv Kutumbakam, exalting the entire world as one family, but has also further cemented India's stature as a true leader in the Committee of Nations. Such a strong display of character in these unprecedented times, coupled with our quest to establish an Atmanirbhar Bharat, a self reliant India which benefits the world, will certainly help our country fulfill its destiny of becoming a Vishwa Guru. And this will only be possible with the proactive participation of all citizens of our country. Together, we shall shape a brighter and more prosperous new India, which will play a leading role in defining the post COVID era on a global stage. On that note, I would once again like to express my sincere gratitude for inviting me to address this esteemed gathering. Thank you and my best wishes for the success of this summit.